Hi, my name is Ed, and I'm a 81-year-old survivor of a stroke. I currently am a retired professor emeritus from the University of California, Irvine. So I've been living in this home here in Orange County for 45 years, and really enjoy this weather and everything until one day when I was watching television at 1:30 in the afternoon. I began having numbness on the right side of my face, like pins and needles. And I said, that's unusual. And then I noticed that my right hand got numb and my right leg got numb. Well, my training as a neurologist in London, studying strokes, told me that I was probably having a stroke. So I immediately had my family call the paramedics, and within 25 minutes I was in the hospital. We got to the hospital, and just prior to their arriving, my blood pressure was 257/160, and I was very, very sure that I was having a stroke at that point. Luckily, what happened was that I was able to go home 2 days later. All of my symptoms disappeared, but I found out that the left vertebral artery, which was what I thought it was, had completely occluded. And if it weren't for the grace of God, I wouldn't be here talking to you today. It would have made me totally paralyzed on the right side of my body. I wouldn't be able to talk, remember, speak, or think. I talked to Dr. Song at Cedars-Sinai, who mentioned that she would refer me to CanDo. And after a few weeks, I got on the phone and talked to Pooja. So Pooja's talked to me almost every week for about 4 months. And then we joined the CanDo group on Wednesday afternoons. And it wasn't until I joined CanDo that I got to meet other members of the CanDo family and learned what their experiences were. It was very important because it taught me I don't want to have another stroke. I've joined them as a family because they give to me a lot of insight into what they're suffering from. And I personally feel that you really don't understand as a physician what is happening until you have the problem yourself. What really is important for a practicing physician who's taking care of stroke patients is to know that the patient oftentimes will not bother the doctor and will just kind of accept what is being said. But I think it's important for open communication being made between the patient and the doctor. One of the problems that I've noticed is that some of the fellow patients have no idea what to do if they have a headache, or is there a problem with they're not seeing to one side, and trouble with ambulation. And it's not that their doctor doesn't know or doesn't take care of them. It's frequently a communication problem. And if the doctor's being very intent on helping their patient, will realize that it's not always easy for the patient to tell you exactly how he or she feels. And there must be a way to do that. And I think CanDo bridges that. It gives a chance for the patient to know that maybe their symptoms are important, and they can talk to the CanDo staff and other patients, and be encouraged to go see other doctors or professional people. Almost always there's something that's treatable in your medical history that could decrease the chance and likelihood of having a second stroke. You don't want to have a second stroke. Never feel satisfied until you ferret out as far as you can the problem and its possible treatment. You want to do preventive medicine.